and I came here today to talk about the death. I want to ask you, how many people here in morning say, "Hi, I'm gonna die"? Somebody here think that? No.
Never.
Okay, that's the question. Well, I was a specialist in leukemia in my hospital, and I changed that in few years ago. I work now with palliative care. Have you ever thought about it? When I talk in palliative care, I'm talking about everybody. For you, for you, for you. Have you do your palliative care today? What is that? I don't know. To swim, to run, something. Because I don't know here if somebody is not gonna die. There is somebody that's not gonna die? No. Then I think nobody has cure. Yes. It's more a conversation. I would describe a case with a patient that more I learn things. Palliative care is indicated to all patients and family members with life-threatening condition for any kind of diagnosis, for all prognosis, whatever their age, or any period of disease in which they have expectancies or necessities that are not met. The question is, who can be cured? Or better, who is not gonna die? Yes, we know everybody's gonna die, but we don't remember that. I want today to discuss that palliative care should be a daily practice of well-being of all people with their all selves. Palliative care should be a practice for all human beings. The case to be described is from a patient with stage 4 lung cancer, diagnosis at 38 years, no smoker, and she was pregnant 27 weeks. It was a physician. This case happened in 13/11/2015, the day of the Paris attack. Never again will that day to be forgotten by the world and the patient. The world stopped it, and in a particular way, her world stopped it too. Then I said now, she was 27 weeks pregnant with complete mediastinal metastasis in the left lung and a 10 centimeters tumor in the right lung. She began a journey searching for life. Her daughter born and died 2 days after, because she was in the hospital and the doctor said, or your daughter born, or we will start the chemotherapy with her inside you. She thought what was better, and she decided that she will born, and she lived 2 days and died. This patient looked for 2 referral services in Brazil. She went to the famous hospitals in Brazil after her diagnosis to gain the second opinion of that. Hospital number 1, the doctor who saw her checked PET-CT along with the resident team. While looking at the images, he cried. What do you think about it? That's not nice. It's not nice to cry. You can cry, but not in front of patient. And along with the resident doctors, he said, "That's such a pity for such a young woman." When the patient asked, "Doctor, I've read this surveillance, 1% in 1 year. That does not apply to me, does it?" In clear attempt of denial. She had just lost her daughter a week ago. Not made a sense, the doctor answered. Yes, in the best scenario, yes. He went in his cemetery to say goodbye for her child. I don't know how can I say this in English, but she had a cesarean. She could not walk. Then she was like a baby.
Crawling.
Crawling, yes. Hospital number 2. A highly recommended doctor who is famous among Brazil celebrities. He looked at the patient and suggested chemotherapy. At the end of appointment, he suggested, "Try it a lot," and smiled. The patient reported that she felt chills at that moment. No. No one has been diagnosed with an incurable disease, want to go on a trip, and besides with the plans of going through chemotherapy and having 7-year-old son to care, for traveling and having fun. Definitely it's not option. It's good to the movies. The movies people go to travel. In the real life, I don't know. I have it, we think, to respect the patient and ask to him what he or her or him would like to do of his life. Okay, because I said, everybody's gonna die. Hospital number 3. This hospital, it was in her city, the first hospital, where her kid has been born and died, and she received her diagnosis. There was an oncologist doctor who was younger than her. He did not talk about prognosis, not about the cure. He talked about the treatment. He spoke calmly and seriously. One cannot say his face was happy, sure. That was pretty serious situations. But even so, he talked about that was going, what happening at that moment. That is important. This moment is important. Yesterday, we don't have anymore. The future, we don't have yet. We have just today. This young daughter, nothing about the future, about travels or anything. He hugged her and said, "We are in this together." This was a young doctor, but he had enormous maturity and empathy. That's the case. What I learned with this patient, empathy. She made her option of being treated him in her hometown close to her son. The doctor did what she herself would done as a doctor. He hugged her and offered her the treatment. Choosing that doctor has totally changed the course of this story. At the end of the life, we are all going to die. But living in hope is a better way of living. But we don't remember that when we talk about this kind of conversation with our patient, because we treat the disease, we not treat the human. We have to remember to treat the human, not the disease. After making use of cisplatin and pemetrexed, she could not use the nivolumab because she was post-cesarean. In early 2017, this patient changed her protocol to immunotherapy to the slow progression of disease. And this is where she remains until the current date, 3 years and 7 months after the diagnosis. She lived this experience in such a profound way that it prevents distortion. She was lucid and sober. An oncologist who was through this experience has certainly something to say. We have nothing beyond our naked existence. That is not important. What matters is how we live until we got to it. During the treatment, this patient searched for self-knowledge and has had a radical change in her values and principles. As a doctor, she realized in college there is enormous lack of teaching of subject of empathy. She herself not being as empathic as she could for many years. And going through that experience has been a game change in her life professional. I don't know you, but I didn't have in my college classes about empathy. I have something about psychology, but empathy is new. Do you believe? The empathy is new. There is a study that I put here. I'm gonna say after. A doctor cannot feel the patient feels, but they can understand that person's emotion. Having cancer is not just a diagnosis. Being an oncologist does not mean just being a doctor. It means understanding that from that moment, the diagnosis on, you become a part of someone's life. You have the choice to make their life better or worse. This power we have. We think we have many powers, but we don't have. But we can do the better life for somebody. I think this is magical. I put this study here just to put, because you can look for that in the PubMed, but what this study say, that the young students has more empathy than the postgraduated and the teachers. How more graduated to stay, less empathy you have. I'm gonna pass because it's not important. Teaching about empathy is really, really, really hard. It's hard to teach somebody to have empathy. But practicing in front of the students is certainly something too relevant. We don't do someone's future. Yes, we can lead people there as far as possible, such as a dance, by respecting the patient's limits and by reminding them and yourself that the only thing we have is today. I took this part from the book that was wrote in 1984 by a psychologist that lived in, what's the name of the concentration? Auschwitz. He lived there. And he wrote this book, it's a beautiful book, that Man's Search for Meaning. A public opinion poll was concluded a few years ago in France. That results showed that 9% of the people would admit that men need something to the sake of which to live. Moreover, 21 patients considered that there was something or someone in their own lives for whose sake they were even ready to die. And Nietzsche said, "He who has a why to live, bear almost anyhow." This patient is me. I am the girl with stage 4 cancer. And in 2015, I could not believe that today I would be in Nice talking with you. Thanks. That was my little baby, me pregnant, my reason to live, me as a doctor, and now I say thanks for my cancer because I am other person. I am not surviving, I live, I not survive. That's really different. Thanks a lot.